A 35-year-old male presented with neck pain and progressive quadriparesis. The patient could walk with support only. MRI of craniovertebral junction showed atlantoaxial dislocation with severe compression of the high cervical spinal cord along with medulla oblongata. CT scan of cervical spine and craniovertebral junction showed mixed variety of atlantoaxial dislocation. X-ray showed the same thing. So after talking with the patient family, we took decision for surgical management of the atlantoaxial dislocation by opening the facet joint and jamming it with bone graft, followed by reduction and fixation by screw and rods. The patient was positioned in front position with long traction on the skull. The craniovertebral junction was exposed to posterior midline approach. Then first right-sided C1C2 joint was exposed and opened, followed by drilling inside the joint for denuding the cartilage. Then left-sided C1C2 joint was exposed. And cartilage, articular cartilage was denuded with high-speed drill. Then joint was distracted. Then C1 lateral mass was identified. Vertebral artery was safeguarded on the C1 posterior arch, and drill was made on the posterior arch of the C1 on the right side for a screw. Then screw was introduced. Then subfacet C2 screw was given. The same procedure was done exactly in the same pattern on the frontolateral side. Then rod was placed into the screw and it was compressed and tightened. After hemostasis, perioperative check X-ray was done to see the direction of the screws and wound was closed accordingly. After operation, the patient recovered well from general anesthesia. His respiration was well and he could maintain saturation of oxygen in with normal air breathing. And the patient recovered in his postoperative days well without any complication. He was discharged on fourth postoperative day with improving status of quadriparesis and he was advised for regular follow-up and physiotherapy.